Hi, I'm Lawrence Bergstrom, registered osteopath of over 25 years experience and a non-surgical spinal decompression specialist. I want to talk to you today about sciatica. Sciatica is a phrase that we use a lot. Lots of people say, oh, I've had sciatica or I've got sciatica. But it can be a bit nebulous, and what we want to do is we want to discuss a little bit about what it is, because education is everything, and if we know what it is, we know what we can do about it. So what is sciatica? True sciatica is pain experienced in your buttock, back of your thigh, your calf, and into a region of the foot. And the symptoms that you can experience can be constant pain, a degree of burning, shooting, dullness, heaviness, these kinds of things. They're unrelenting. You know, most of the time you've got the pain. Perhaps if you lie down, it eases a little bit. If you sit, often it can make it worse. You can walk so far. Car journey aggravates it, these kinds of things. Or a cough or a sneeze will immediately make it worse. Well, what's happening? Invariably in the spine, one of the major causes of sciatic pain is where a disc starts to bulge into this space. These spaces are called foramina, but for our purposes we'll call them windows. And there's only so much space in that window for the nerve which sits in that window to live. Now, once that window starts to become squeezed, or what we call stenosed or narrowed, then trouble occurs because the nerve is starting to be pressurized. Now, if you think about a nerve that you will know about, the ulnar nerve, and at this point you'll be thinking, I've no idea what the ulnar nerve is. If I call it the funny bone, now you know what I'm talking about. And that is right in here. And it sits in this groove of bone here, the ulnar nerve, and it's relatively protected by that groove. But if you hit it for a split second, wham, you know all about it. You get pins and needles and shooting pain, you shake your hand out, and it's at that point we always say, why do people think that's funny? Because it's not, it hurts a lot. Well, imagine the same scenario with pressure on that nerve for long enough. You're going to have those symptoms coming down the rest of your forearm into your fingers. Well, that's pretty much what's happening with sciatica. Now, invariably with sciatica, more often than not, it's disc bulging into that space, what we call degenerate disc. So the disc is starting to lose its disc height and it's starting to squeeze into this aperture, this window. So that's a common cause. Sometimes you can be unlucky and you can have a cyst in there, and you might have physical therapy, manipulation, chiropractic, osteopathy, physiotherapy, do your exercises, take pain medication. It's not getting any better. And on occasion, we'll send a patient off for MRI, they'll have a cyst there, and then the orthopedic consultant will deal with that and get rid of that cyst, and then symptoms go away. Other times what can happen is when the spine is becoming very degenerate or perhaps particularly elderly, this space is getting narrower and narrower and narrower, and so that nerve is now starting to be squeezed. Okay. Now, if it's very early stage, manual therapy can help with that. Exercises can help with that. It's true that a lot of low-grade sciatica, in 6 to 8 weeks, it can resolve itself. We typically see at Swell Back Pain Clinic the patients that say, I was told within 6 to 8 weeks this would be better. It's not getting better, or it's getting worse, and it's making my life sheer hell. Can anything be done? I don't want surgery. Good news, 92% of our patients that have this problem don't need surgery. Admittedly, by the time you've got 8, 10, 12 weeks in and you've still got pain, it's rare that we resolve it in a couple of sessions. We do have a proven system of care, and it is a system, so it's a number of sessions. We use the latest advanced technology to help decompress that disc, take the pressure off the nerve, and gradually the nerve begins to recover. You start to get your normal function back, your pain reduces, your medication reduces if you're taking medication, and then 92% of cases we greatly improve or resolve the problem. Very rarely is sciatica sinister, But at the clinic, when people have prolonged sciatica, we always refer for MRI. So that's something to bear in mind. If you're going 6, 8, 10 weeks, it's not getting any better, you want an MRI. We can refer you quickly for that. We read the results to you, we safety net you to make sure there isn't one of a small number of more, shall we say, sinister problems that could be causing your pain. Very uncommon. They do occur on occasion, but rarely. More often than not, we're dealing with disc issue, we're dealing with arthritic changes, we're dealing with calcified ligaments, and we can help you with that. So take home message: sciatica not improving, we're 8, 10 weeks in, misery, medication's not helping. Don't suffer in silence anymore. Don't sit and wait months and months and months to be seen orthopaedically. We can get the ball rolling for you very quickly. So contact us at the clinic. You can call us on 01795 720 326. You can go to our website. There's a contact page there. We'd be happy to receive your information and get going. www.swalebackpainclinic.co.uk, or send us your history, any reports that you have, if you've had an MRI within the last 12 months, because after that, really, the shelf life of the MRI is diminishing. You can email us at clinic@swalebackpainclinic.co.uk. Email us your history, email us your email reports. If you've got an MRI portal and you've got all the images saved there and the reports, and you're happy for us to have that, email that to us, and then we can study it straight away before we even meet, and then we can get on the phone to you, we can discuss whether we believe we can help you, and then we can get that ball rolling. Okay, thank you for taking the time to watch this. If you have sciatica, it's not the end of the world, you're not doomed. Thank you.